In the bustling landscape of modern healthcare, an age-old therapy is finding its way back into the spotlight: sound. The idea that sound, particularly in the form of specific frequencies and vibrations, can play a role in healing and well-being is gaining momentum. This therapeutic approach, often referred to as sound therapy or sound healing, harnesses the power of sound frequencies to promote relaxation, reduce stress, and even alleviate certain physical and emotional ailments. The science of sound frequencies. Sound is, at its core, a series of vibrations that travel through the air as waves. The pitch or frequency of a sound is measured in Hz, Hz, and it determines how high or low the sound appears to our ears. Sound frequencies are integral to our daily lives, but their potential for therapeutic use extends far beyond casual listening. In the realm of sound therapy, specific frequencies are thought to have distinct effects on the human body and mind. For example, binaural beats. This technique involves playing two slightly different frequencies in each ear, creating a perceived third frequency through the brain's process of neural entrainment. Binaural beats are believed to help induce states of relaxation, focus, or even sleep. Solfeggio frequencies. An ancient musical scale believed to have profound healing properties, the solfeggio frequencies consist of specific Hz values, such as 528 Hz, associated with DNA repair and transformation. 432 Hz versus 440 Hz. The debate over the ideal tuning frequency for musical instruments has been ongoing. Some argue that the 432 Hz tuning is more harmonious and resonates better with human biology, while the standard tuning is set at 440 Hz. While it's important to note that sound therapy is considered complementary and alternative medicine (CAM), and scientific evidence is still evolving, there have been anecdotal reports of healing and improvements in various conditions. Here are some cases where sound frequency therapy has been explored. Pain management. Chronic pain. Some individuals with chronic pain conditions, such as fibromyalgia or arthritis, have reported relief and relaxation through sound therapy. Frequencies like 432 Hz and specific binaural beats are often used in these cases. Stress and anxiety reduction. Generalized anxiety disorder. Sound therapy sessions, which include listening to calming sounds and frequencies, have helped individuals reduce their anxiety levels and achieve a more relaxed state of mind. Sleep disorders. Insomnia. Soundscapes with delta and theta frequencies have been used to promote deep sleep and alleviate insomnia symptoms in some cases. Migraine and headache relief. Migraines. Listening to specific sound frequencies, such as binaural beats, may help some individuals reduce the intensity and frequency of migraine headaches. Tinnitus management. Tinnitus, sound therapy, often referred to as tinnitus retraining therapy, uses specific sound frequencies to help individuals habituate to the ringing or buzzing in their ears, reducing distress and improving quality of life for some patients. Emotional healing. Trauma and PTSD, sound therapy, combined with counseling and other therapeutic approaches, has been used to help individuals process and heal from traumatic experiences. Cognitive function and focus. ADHD. Some individuals with attention deficit hyperactivity disorder, ADHD, have reported improved focus and concentration through the use of binaural beats and other sound-based therapies. Epilepsy management. Epilepsy. There is ongoing research exploring the use of specific sound frequencies and neurofeedback in managing seizures and improving the quality of life for epilepsy patients. Autism spectrum disorders. Autism. Sound therapy has been used in conjunction with other therapies to help individuals with autism manage sensory sensitivities and improve communication skills. Recovery and rehabilitation. Physical rehabilitation. Sound frequency therapy, particularly music therapy, is used in rehabilitation settings to aid in motor skill recovery and emotional well-being during the rehabilitation process. In various spiritual and alternative medicine traditions, specific frequencies are sometimes associated with the activation or opening of the third eye. a metaphorical concept representing heightened perception and spiritual insight. However, it's important to note that these associations are not based on scientific evidence, and the effectiveness of using sound frequencies to open the third eye is a matter of belief and subjective experience. One frequency often mentioned in this context is 936 Hz. This frequency is sometimes associated with the activation of the third eye chakra, which is believed to be located in the forehead, slightly above and between the eyebrows. In some belief systems, it's thought that listening to music or tones at 936 Hz can help facilitate a sense of inner awareness and intuition. It's important to approach the use of sound frequencies for spiritual or meditative purposes with an open mind and a healthy dose of skepticism. While many people find value in sound-based practices like meditation or binaural beats, scientific evidence supporting the direct opening of the third eye or specific chakras through sound frequencies is limited. If you're interested in exploring sound therapy or meditation for personal growth and self-awareness, it's recommended to do so in a safe and responsible manner. You might consider listening to different frequencies, such as 936 Hz, in a calm and meditative setting to see if it resonates with your own experiences and goals. However, always keep in mind that individual responses to such practices can vary widely, and they should be used as a complementary tool rather than a substitute for professional medical or psychological care. While sound therapy holds promise, it's essential to approach it with caution and in conjunction with conventional medical care. Not all claims surrounding sound frequencies are supported by robust scientific evidence, and individual responses to sound therapy can vary. Incorporating sound therapy into medication should be guided by a healthcare professional, particularly when addressing specific health issues. The frequency of sound, when harnessed thoughtfully and responsibly, can become a harmonious companion in the journey toward healing, offering solace and balance in a world often filled with discord. As the science of sound continues to unfold, it may hold a key to unlocking new dimensions of health and well-being.